With thousands of students back on campus, the university is ramping up COVID-19 testing. For the first time, Elon University will rapidly test students weekly, beginning tomorrow.
I wish our system had been perfect in the fall. It wasn't, and I think it was complicated and frustrating sometimes for students about how do I get a test?
For the next few weeks, the university will be using tests donated by the North Carolina Department of Health and Human Services. In the coming weeks, Chair of the Ready and Resilient Committee, Jeff Stein, says the university will transition to rapid antigen tests as they become available.
So the NCDHHS has helped us to get to this point and a little further, and then we'll be able to work with Abbott going forward from here.
The new term is also bringing changes to the COVID-19 alert model. The highest alert level in the new matrix now allows for more than 30 new cases daily, compared to 30 cases weekly in the previous model.
We wanted it to be a more realistic matrix that would not suggest we were going into campus quarantine when we weren't. In the fall, I think, because we had just created this model, we didn't know what kind of numbers we would get.
Stein says the changes were made based off of the fall clusters, which he says didn't affect the spread of the virus in the larger campus community. While testing and quarantine are a key focus for the university's coronavirus plan, they're also looking forward to the vaccine. Here in Burlington, the vaccine is already being administered to healthcare workers and those over 75. Elon University Medical Director Dr. Jeanette Archnell is one of nearly 500 people in the county to have received both doses of the vaccine.
It's not a get-out-of-jail-free card. There's a lot we don't know still. We're not sure how long the immunity lasts, and we're not sure, simply because it hasn't been around long enough to do enough tests to get a definitive answer, whether I can actually give COVID to somebody.
But students may have to wait longer to receive the vaccine after the state announced college students were no longer going to be prioritized.
People who are at highest risk of catching it and then at highest risk of ending up in hospital if they do get it. That's how the staging of the vaccine is going. And I think people don't necessarily always understand that. I know that there's a lot of frustration that people can't get the vaccine they wanted. But there's a reason it's being phased in.
Stein says the university is still continuing to research and consider plans to vaccinate the community.
It's one of those things that feels like it's rapidly changing, but not moving at all because there aren't a lot of specifics. I hope the community knows that the university's goal is to make sure that students, faculty, staff, and the local community can get vaccinated as soon as possible.